Hello, ladies and gentlemen. Thank you very much for joining me today, live from beautiful Ojai, California, on this very important subject, talking about our kidneys, our bladder, and of course, the urinary tract and the kidney pathway, kidney bladder pathway, and the types of complications that result from this system not working properly. So first, I'm going to cover some of the and then, of course, herbal treatments. First, I'm going to cover some of the typical symptoms in different category as per Ayurveda. And then I'm going to talk about some of the causes, because obviously we should talk about the cause. And then some of the herbs and herbal formulas that are used to resolve these conditions. So first, let's look at we call it our bladder, kidney, urinary system. And let's talk about it from first simple point of view. We don't need to talk only about medical conditions since like kidney failure per se. Let's just talk about basically understanding imbalances of this system to avoid more serious health problems in the future. So first, we can have excess urination, which in Ayurvedic terms is vata, and this is usually we have that includes nighttime urination, running to the toilet, and then urgent urination, but that's slightly different. Just excess urinating too much. Of course, a woman's bladder is a little smaller than a male bladder, so women have to go relieve themselves more often than men. That's normal, so you can't compare yourself between genders. But men 4 or 5 times a day, women 5 or 6 at the most. So if you're going every couple hours, then this is excess urination. If you're going at night, excess urination. If you can't hold it for an hour after 1 cup of liquid, in excess urination. And ultimately, this excess urination dehydrates you. And of course, when you become dehydrated, this can even lower your blood pressure, make you tired, give you heart palpitations, and even affect your sleep. And you can even feel faint, from this. And even, what are some of the causes of this excess urination? Any guesses? How about just drinking too much water all day long? This is the most common cause that I see. People are very proud to tell me they drink 5 liters, 6 quarts of water every day, but they're urinating at night and they're dehydrated and they can't understand why they are still dehydrated. So if you drink too much water too quickly, then this can even deplete you, because it's like a cleanse. You're like washing yourself out, and now of course we know we're washing out minerals, washing out electrolytes out of our body by having excess water. Very common. And what else stimulates this type of excess urination? Good guess. Coffee. Exactly. Somebody said coffee and even alcohol. And there's a lot of things that are diuretics that by drinking like a watermelon juice, drinking a lot of watermelon, also a diuretics. A lot of melons, for example, can be diuretics. You drink them too much or have too much, then you actually become dehydrated. And of course, we know this with coffee, that you drink 1 cup of coffee and you urinate out more liquid than you drank, and then it actually dries you out and leads towards dehydration. But other conditions, even anxiety, of course, can increase urination. So somebody with nervousness, anxiety issues often will have urination issues as well as excess urination. And of course, conditions such as diabetes are related to this system as well, and often result in excess urination. And that's a subject by itself, which I've covered in other webinars. But in Ayurveda and ancient science, they do contribute it to the same water system, including the pancreas, which is another upper part of the water system in Ayurveda, the intake and the digestion of the water. And then the second half of the water system is the elimination aspect of it, the processing. Kind of like we have the water company supplying the water, and then we have another company sanitizing the water and putting off the waste. Well, the body's the same. We have to digest water, and then we have to eliminate excess water along with any unwanted minerals and the toxins often created from our digestion, which can be measured. And it's this increase of these toxins, urea, like this bun test that you do, for example, that shows that the kidney's not functioning properly because there's excess of these toxins that the kidney's supposed to process. So excess urination. So you want to get it just right. Just like in Ayurveda, we don't always look at things as in terms of do we have a disease or not. We look at in terms of is it balanced or not. So you don't want to be urinating too much, and you don't want to be urinating too little. And often some people who have type of urinary tract infections, instead of fixing the infection, sometimes drink less water, which can make it worse because they don't want to have to run to the toilet or go at night. So we're going to talk about urinary tract infections and bladder infections in a moment. Now I want to talk about symptoms of and signs of lack of urination, which can be resultant often in a type of blockage. So you can have symptoms are often dry mouth, craving for more water, craving for sweet juices, like sugarcane juice. And this can be caused by, of course, kidney dysfunction and high blood pressure. But we're talking about the symptoms, would be excessive thirst, dryness in the mouth, and inability to have like a strong flow where you're having dripping, not strong flow in the urination. And this is going to be due to blockage, which we're going to talk about in a minute. So we're going to talk about infection, and we're going to talk about blockage in the kidneys, and we're going to talk about even to some degree kidney failure. But I wanted to just cover these two easy to understand areas that you want to evaluate the state of the system at. Because this is the way Ayurveda looks at the human body. It looks at all the different systems that we have. We've got respiratory system, we've got digestive system, circulatory system. We even have our mental system and reproductive systems. There's different ones. Women have a few. And now we're talking about this urinary, kidney, bladder, urinary tract system. And you want to make sure, like I said, you're not urinating too much and you don't have some kind of blockage. So we'll go on to, and urinating too much in Ayurveda is considered a vata condition. Vata is where there's a lot of energy, a lot of activity, a lot of movement. These people are often nervous, anxious, and very active, and they're in that type of energy, and this type of can create excess urination. Particularly, it goes hand in hand with anxiety, and this can be quite disturbing, particularly when it affects your sleep. Sometimes when I speak publicly, I ask people to raise their hands if they think they're healthy, and most people raise their hand, and then I say, well, let's check a few systems to see if all your systems are working. And one of them that I cover is urinary tract system. I say, do any of you get up at night to urinate? Quite a few people, particularly women, raise their hand. So I said, well, so that system's not working if you're having to get up at night. So, and it affects you in many ways, because if you don't sleep good, then, you feel tired, fatigued in the day. You'll be more tempted to drink more coffee, more stimulants. And of course, your immune system becomes weaker. And with a weaker immune system, you become more susceptible to infection, which is really a progression of this problem. So sleeping through the night's essential for good health. It's considered one of the prerequisites, besides good digestion, good elimination, and good sleep. These are prerequisites. So it doesn't really matter what health condition you have. You should have a good digestion, not have a lot of gas and bloating, constipation, or acid reflux, good elimination, having bowel movements a couple times a day, and having sweat. I didn't do a talk about the sweating system because I thought maybe it's not exciting enough for people to get a good audience here. But the sweating system is very important too. So if you have dry skin, you're never sweating, even you do light exercise, you're not sweating, so that system can be blocked, and you can often see people with these blocked sweat system, dry skin. They have a lot of skin problems. But we're talking about the urinary system. So if you're not urinating enough, then this is going to accumulate types of toxins and create further blockages in the kidneys, which can then lead to infection. And we're going to cover that. So let's talk about blockages, because that's a kapha problem. So over urination is a vata problem, too much. And then when we have kidney stones, or we have a blockage in the kidney, this is a kapha problem. Now we have something that's blocking the pathway. Now I don't know if anybody of you passed any kidney stones. I haven't, but I've had a lot of patients who have, and they told me it really hurts. And I've had women who've had many children, and they said they'd rather give birth to another child than pass a kidney stone. So I haven't had a kidney stone or given birth to a child, but doesn't sound good. Sounds real painful. Grown men have said they cried. So it's very painful to pass these stones. So you don't want them to accumulate. And one of the causes here of this type of blockage, which is what we're on to now, or I should say the symptoms first before the causes. Symptoms is can be a little pain while urinating, little like sand coming out, pee in a jar. Look at the jar, see if there's any sediment in the bottom. Not good. And then any pain, of course, is you're already in an advanced stage. But just blockage. Just go to urinate and then sit back down, and then 15 minutes later think, God, I got to go back and finish urinating. That's the early signs of some type of blockage. A lot of people complain of dribbling, dripping in the underwear, things like that are also indications that you're not having a good flow. I always, ask the men to, sometimes describe the flow. Is it just going and dripping, or you got a nice, and if they go, no, it ain't going, it's going drip, shake, 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 drip, drip, drip. So this is signs of blockage, because when you're healthy, you have a nice flow to the urination. So you don't want to be urinating too much. That's a vata condition, like over functioning. And then you don't want to have it blocked, so you have to go back to the toilet and you're dripping and you're wiping, and this is signs of blockage. You can sit around and wait 6 months, maybe a year, maybe 5 years before you have a serious problem. And that's what people generally do, is they put it off, because I meet people every week with kidney stones and blockages, very common. And they all tell me that they had this dripping, this pour for 5 years, 10 years before they actually got one day some pain. And then it hurt, and then they ran to the doctors, and then the doctors told them they had a kidney stone. So, but the signs are way earlier. Little stones, little hard calcifications do occur way in advance. What are sometimes the causes of this? Again, a dehydration. Excess urination creates dehydration, but when you have when you are dehydrated, maybe you're on the other side of the table, you're not drinking much liquid. Maybe you're just having diuretics like coffee and alcohol and things like this, or sugary substances like soda pop. So you're dehydrating yourself. Then this can contribute to this type of blockage. Other common causes, even sweating too much. Some people, their body temperature very hot, the type people, and they sweat a lot. And that sweating is drying them out, and then they don't urinate much. So the body can really get rid of the extra liquid either through sweating or urinating. So if you sweat too much, then not enough is going through the kidney bladder pathway, and then this creates this environment both for infection, which we're going to talk about in a minute, and blockage. This is the main things you want to avoid in your kidney and bladder and urinary tract is infection and blockage. And if you get blockage, then you're very susceptible to infection. So if you're dehydrated, not drinking enough water, or you're sweating a lot and losing a lot of water, then you have a greater susceptibility to this. And also, excess consumption of the nightshades. You know the nightshades? Phil, you can text me here while I'm going. Tomatoes, eggplant. These are we also can call them like acidic foods, or they're high in acylic acid actually, and this constricts flow, tightens up, which can be useful in some conditions in some people, but excess use of tomato sauce, or nightshades can exacerbate this problem, and kind of like a garden hose, it kind of shrivels it up a little bit and makes it tighter, and this creates more susceptibility to blockage. And of course, kidney disease can result in this, and even parasites, bacteria can result. Just like a blockage can then lead to infection, well, parasites and excess bacterial growth can then lead to blockage, and then infection can lead to excess urination. So we're really talking about three categories of problems to the system here: overactive, excessive flowing, infection, and a blockage. So we'll go on infection now, which is probably the most common for most people, and physiologically, because of the design of women's urinary tract, they're more susceptible to infection, particularly sexually active women, and taking baths a lot can make a woman more susceptible to these urinary tract infections. I did once meet a bladder surgeon. He was in one of my classes somewhere and stood up. I was in Santa Barbara, I believe. And he said, "You're correct, Mr. Southwick, that it's very common people have urinary tract infections, but the tests don't show positive." And I said, "Oh, thank you very much, sir. How come?" And he said he was a bladder surgeon, and before they have surgery on the bladder, they always want to see the blood work and make sure the person doesn't have an infection. They say, "Oh, there's no infection, nothing in the blood work," but when he does the surgery and he actually looks at the bladder, there's often infection. So he believed that over 50% of all adult women had minor urinary tract or bladder infections, even if the tests don't show up positive. So let's talk about this. Infection, and it can take place in the urinary tract and in the bladder. So if it's in the urinary tract, then you're going to feel it, the stinging, the burning, the running when you pass urine. But if it's in the bladder, then you can't hold it. Then there's infection, inflammation, basically resulting inside of the bladder, and this is making you go to the toilet more often and run to the toilet. And of course, good news is there's herbs that take care of these issues that we're talking about here today. Infection and blockage. Those are the two main ones that the herbs are very good at working with, and how the herbs are divided. So if you have a urinary tract infection, then we have to see, is there blockage too or no blockage? And if there's blockage, then we have to see, is there infection too or no infection? And this will determine the herbs that are used for this type of treatment. So let's talk about a few herbs here. We'll do Western herbs first. The main herb that we use for urinary tract infections, anybody can guess, is in Western herbalism, ursi. Ursi is a wonderful herb for fighting urinary tract infections. It's a diuretic. You can't take it. You don't want to take it too long because it could technically dehydrate you if you drank it for months. But most of the time, people only need to drink it for a short period of time. But let's look at a few other herbs which I didn't bring up here, but are in my kidney bladder tea. And it says relieves urinary tract infections, bladder infections, increases urine flow. Takes 7 to 10 days, and then take a break for a few days. So you don't want to take this too long because it's diuretic. The first herb actually in here is nettle. We all know nettle is very nurturative, supportive to the kidneys, and in fact, you could drink nettle tea and maybe solve a minor kidney infection. But next ingredient is ursi. So nettle is more of a supportive herb, just all-around tonic for the urinary system. And then ursi is the infection fighter, the strong one. But we backed it up with juniper berry. Juniper berry, which I have growing right outside here too, is also very good for fighting urinary tract infections, antifungal, antiviral, antimicrobial, and very effective. And we put in horsetail too. Horsetail is another diuretic, and helping to get the flow moving good. And slippery elm, that's to soothe it out, soothing or some burning. And white oak. White oak is an astringent. It helps the bladder kind of tighten up. Just like we use a red raspberry leaf to help the woman with the uterus to tighten it up a little bit. It's an astringent quality. That's why red raspberry leaf is considered the mint for women, because it helps to tonify the uterus. So white oak bark is tonifying the bladder, because we can have like lazy bladder, lazy colon. I don't know about lazy uterus, but we definitely can have a lazy bladder. And this helps. There's a astringent quality to white oak, starts tightening up. So this works very well. But if you didn't have all these herbs, you could just do like nettle and herbal ursi for 7 days, and you'd probably get pretty good results. Most women said they never finish this bag of tea, and their urinary tract problems are resolved. You know, of course, being an herbalist, a well-known herbalist, sometimes I do get people pounding on the door in the middle of the night. Give me your tea for my urinary tract infection. Because it's obviously very painful. And I've given out my little $15 bag of tea and told them drink 4 or 5 cups a day between meals with extra water. And within a day, they feel better. 2 days, it's gone. And then I always tell them after all the symptoms are gone, take it for another couple of days to make sure I don't take it any longer than 3 days after all symptoms are gone. And you notice a lot of herbs, how you take the herb is very important. Like liver herbs are best to take with the food. So it goes and with something fat. So a lot of the liver herbs are in fat. We put them in ghee. We put them with, at least with the meal. So they go to the liver, right? I mean, you don't want to just be drinking your liver herbs and urinating them out. But when it comes to the urinary system, if you want to reach it, then you're going to do better not taking the herbs after the meal or before the meal, but between the meals with a lot of water, because that's your goal. You have to get the herb to the right spot. So if you just take herbal ursi capsules after your dinner, it may not work well. You need to take it in a liquid form, in a tea with a lot of water, until you're urinating it out. So the actual herb is going through the pathway, the kidneys, the bladder, the urinary tract, urethra, and with the herbs in it. You don't want to digest it. So these type of herbs and this type of treatment shouldn't be done in powder form, tincture form. I mean, if you have a little tincture of herbal ursi and you put it under your tongue, well, it just absorb right in that area. It's just not going to get down to the urinary tract. So you can have the right herb and take it in the wrong way, which I see is very common. And this is the case with herbal ursi and this type of treatment. It's a very simple treatment. You just have to take it with a lot of liquid to get it to the right place. So that's very effective. Now, we have another formula here called kidney stone tea. And this is more for the blockages, particularly kidney stones. The other one will get the flow going. I mean, people have told me, wow, it's flowing now. I mean, the men have told me they can stand 2 feet back from the toilet now, shoot it right in, like when they were young boys. And that's what men like to do. They like to shoot it, not drip it. So, and many men have told me right off the bat, even men with prostate issues where we have to get things moving, get the flow going, get down inflammation, then one of the first signs that they see is improved flow. Same for the women. They just can't have as much fun as we do. But let's take a look here. This one really clears it up and gets going. So we're assuming there's no infection in this case. See, the other case, it was infection, the burning. So there's a little cooling herbs in there, like just to bring down the heat. Sometimes I would put in some coriander in it, but the horsetail is cooling, and the slippery elm is also cooling and soothing because there's an infection. This one, we're assuming no infection, just blockage, particularly kidney stone. And, you know, there's many types of kidney stones. We don't really need to know. All we know is it's blocked. It ain't coming out. We better clear it and start to dissolve these stones. If they're big stones, then actually I give them some other herbs to take after meals as well to help dissolve these stones. But if they're just small and we can flush them right out, then we use this formula. And the main herb here is gravel root. Gravel root looks like gravel, basically. And it's really hard. Isn't that funny? Its main call to fame is it dissolves things, particularly kidney stones. Dissolves. It just helps break them down and dissolve them. I have a great testimonial on there of a man who just gave like a half-page testimonial that he had big kidney stones and had a lot of pain, a lot of experience passing them. And he gave me a great testimonial, and it was on this tea. And he said that kidney stone tea, made all the difference because he had to pass them because they were big, but he really could feel that they were being reduced in size and passing more smoothly. So again, the first ingredient is nettle, then horsetail, then gravel root. So almost the same. We do some marshmallow root or slippery elm in there as well to make it a little slippery, to make the path smooth, to help it come out. It's a very simple formula. It's mostly the gravel root with a little nettle and a horsetail, which are the diuretics. And the horsetail is the diuretic, and nettle is like the tonifier, the supportive herb for the kidneys. Very effective, very quick. Most people, kidney stones, you may need 2-3 bags of it. I've had people buy 3, 4, 5 bags. The kidney bladder tea is mostly for infection. 1 bag, half a bag, you're taking care of it. Now, if you have a lot of stones, then you may need 3 or 4 bags of it, and you may need to take it for a few months. And like I said, if they're really big stones, then I'll give you another formula as well, Indian formula that helps to dissolve the stones. So let's talk about, so there's infection and blockage. These are the main areas you want to work on. People sometimes come to me with some type of urinary problem where they're running to the toilet, peeing, dripping, and getting at night. And they said that the doctors were still doing tests and they couldn't determine what to call it. So I said it's not important what to call it. What's important is that we get the system working properly. And that's the way Ayurveda uses. We don't use as herbs. We use it to fix the problem. I mean, the herb, in this case, the herb of ursi and the nettle, kill the infection very effectively. You can't deny it. It's very quick. Any woman with a urinary tract infection drinking the right prepared tea with fresh quality herbs, because you have to have good quality herbs or it doesn't work. I mean, whether you're talking herb of ursi, turmeric, cannabis, or dark chocolate. It's all to do with the quality. That's what's important, is the quality. I mean, if you have low quality dark chocolate, you don't have good chocolate. If you have low quality old 5-year-old herb of ursi that sat on the shelf for a long time in a capsule, you may not get the good results. And herb of ursi isn't that good of an herb to be taken all by itself. It's better to be mixed with the nettle. And the gravel root's a really strong, potent one. It needs to be boiled. You have to boil it and do the decoction. And it, again, is a very strong, powerful herb. So it's better that it's mixed, again, with some nettle, some horsetail, and other things to, like marshmallow root or slippery elm. If there's burning and if there's pain, then you want to add in those slippery elm to soothe things out. So now let's talk about the premier herb in Ayurveda and some Ayurvedic formulas, which, both are working quite well. Gokshura is the main herb that's used for all urinary system and even the reproductive system in Ayurveda. Well, little few, and all the formulas that are for the urinary tract are based on it. It's also cooling and has nice sweet taste, and it's a diuretic, demulcent, which means it's like a slippery elm. It's soothing. It's aphrodisiac too. That's good. Analgesic, nervine, tonic, rejuvenative, antispasmodic. So indications: painful and difficult urination, kidney or bladder stones, edema, gout. Some other conditions, including impotence, infertility, sciatica, and we also use it for enlarged prostate. So it's used for not only the kidney bladder, but also for particularly for the male reproductive system. And many herbs formulas are then made using gokshura. Here we have one. It's called renal cure, and actually this is for kidney failure. And the first herb is gokshura, and then Punarnarava, then Varuna, Palash, Kasni, and sandalwood. So besides sandalwood, unless you know Ayurvedic herbs, you may not be familiar with it. But it revives the kidneys and improves flow and also helps to dissolve stones. And it can be taken for more serious cases, particularly when there's kidney failure. Well, we're kind of on the subject of kidney failure. It's a very serious condition. We know that there's no medical treatment besides dialysis. And I do get cases of kidney failure. And generally these cases are due to a few reasons. One, high protein diet. So we get young people, bodybuilders, starting to have kidney failure problems due to too much protein powders, too much protein in the diet. It can be very harmful. I probably get maybe one every month or two, a young person in their 30s that has been diagnosed with early stage kidney failure due to high protein diet. And you can always tell they're very buffed out and doing a lot of protein shakes. That's a common cause for young people, only in modern times, because in the past I don't think we had issues with high protein diet. Generally, we had issues more with low protein diet in the past. People didn't have the financial means to be having goat every day, but now we tend to have too much protein in our diet, and some of us seem to be obsessed with it, particularly those who are into bodybuilding. So it's very susceptible to kidney problems, and medical doctor is quite aware of this problem that high protein diet, particularly these protein shakes, can contribute to kidney failure, even early in life. And then also causes, of course, all medication. Almost anything harms the kidneys. Most of the cases I get with kidney failure have been on blood pressure medication and other, cholesterol medication for 15, 20 years, and eventually these do damage the kidneys. So you get the person who's had the high blood pressure, they're taking some medication for that. And of course, pain relieving medication can be even more harmful to the kidneys. There's different degrees of the harm that's done to our kidneys on different medication, but even aspirin can be damaging for the kidneys. And while we're talking about harming the kidneys, other causes are synthetic vitamins. Calcium citrate can make kidney stones, and many synthetic vitamins, particularly these cheap forms of calcium and magnesium that we find in supermarkets that are not food-based, can contribute to kidney stones and blockage in the kidneys. And then, of course, when there's blockage, you can have infection. And if you have infection plus blockage for many years, you can start to have kidney problems, kidney failure. And if you combine this with taking a lot of medication, then this leads to kidney failure. And it's apparently the rate of kidney failure is much, much higher in the last 10 years than it was ever before. So it's increasing. It's one of these conditions that doesn't seem to be getting better, but getting more. And this is due to two things: a higher protein diet, which we tend to be, many people are somewhat obsessed with, and then second, more medication and more synthetic vitamins in our diet that are harming the kidneys. I mean, everybody can take a little sorbic acid, calcium citrate, calcium magnesium once in a while. It's not going to hurt us if we're on vacation, but when people take these every day for 20 years, this is where it can affect the kidneys. Same with aspirin. It's not going to hurt anybody taking aspirin once or twice, but excess acid, aspirin, of course, can damage the stomach lining, contribute to ulcers, and also create damage in the kidneys. So that's a whole vast subject by itself. But these are the three areas that you really want to look for and try to diagnose your own system. Excess flow, we'll summarize here. Excess flow, urination too much. So you want to get rid of diuretics in your life, coffee, alcohol, sweets, soda pops, and don't drink as much water. Try to reduce it down. Have more liquids in your meals, like soups, and sipping warm tea throughout the day instead of gulping down large amounts of water. And then, of course, blockage. Blockage, if there's any blockage, then these herbs work very well. Diuretics can work well. Just nettle tea, parsley tea could, help. And then changing the diet, eliminating synthetic vitamins, particularly the calcium and magnesium and the mineral-based synthetic vitamins, changing over to a whole food vitamin or using other natural sources, superfoods and juicing and things instead of taking these synthetic vitamins. And then, of course, if there's infection, then the teas really work the best. You know, I mean, I know people talk about cranberry juice and things, but I think most of my clients had urinary tract infections. By the time they got to me, they said they already tried the cranberry juice. So really the fastest, quickest way to fight these urinary tract infections is, it's hard to do it at home once it's gotten very infected. I mean, in early stages, you know, maybe some nettle tea with some cranberry juice, you may take care of it. But by the time they come to me, it's generally burning, painful, and the herbs just work so well, so quickly, that I can't imagine there could be a better cure for urinary tract infections than these herbs. And Ayurveda has other formulas too. There's a formula called Chandraprava, and it's using shilajit. Shilajit's also very good for the urinary tract and cleans it out. And it's also got gugulu. Gugulu is also good for breaking down stones, clearing, getting things moving. So if you're having, you have to look at this system in your body and take it seriously. And if you have this type of dribbling urine and poor flow, then you want to address it. You want to get it working. And if you're urinating at night, back to this urination at night, most women who say they're urinating at night, I give them this tea, even if they say they don't have a bladder infection. And 9 out of 10, it works. So I'm not sure if there's an infection, but they're urinating at night. They're running to the toilet. Tests came out negative. They didn't have infection, but I give them the tea. They drink it for 7 days. They stop urinating at night, and the flow is better. So, you know, it's very effective. And that's what we want, is results. We don't have to even know exactly what it was, but we do want, in herbalism, we want results. You know, that's what we want. So we want to stop the urination at night. So they're working very well. And then sleep gets better. And then, like I said, all of life becomes better when you're sleeping better and not urinating at night. And then, of course, kidney stones can take a few weeks, even a few months to dissolve big kidney stones. And the diet has to change during that period because you don't want to form more stones. And there's other kind of flushes and herbs that you could do as well. But small stones, like you just see sand, or you start to feel a little pain and while urinating, but it's not an infection, and you can pee in a clear jar and then look at this under the light or let it sit and see if there's any sediment. This is a good test to see if you have infection. Of course, if there's blood in the urine, this is more serious, and you want to probably have that checked medically if you have blood in the urine. So I hope that helped give you some ideas, help you to understand your own urinary system, to determine if it's working properly or not, whether it's overflowing or blocked or inflamed and infected. And the good news is the herbs are working very good in these areas. You know, when it comes to kidney failure, it's very advanced. Damage has already taken place to the kidneys, and only in early stages where creatine levels are not that high, uric acid is not that high in these early stages. It can be reversed with herbs. And there is a man in India, and there's, I think, a few, but one I know that is famous for helping people get off of dialysis using herbal treatments. And I have visited him a few times. I've learned a lot from him about different herbs. And at this point, I think I've helped some people avoid dialysis by bringing down creatine levels, uric acid levels, getting the Bun numbers better, and having them avoid dialysis. Now, unfortunately, it's a very strict diet, probably the most strict diet. Ayurveda really doesn't advocate that strict of diets most of the time because we have the herbs to do the job. We don't need to be radical with the diet. I see this a lot of times. People have candida and they do these radical diets of no fruit for months and months and months, or They think they have parasites, or maybe they do have parasites, so they don't want to have any carbs or any sweets, and this goes on for months and months. Meanwhile, they're depleting themselves, killing themselves. Ayurveda doesn't really have to do that type of extreme diet, even say for urinary tract infection or candida, yeast overgrowth. We just drink the herb all day long and let the herb kill it. You know, this concept of not having any sweets to avoid candida, well, you know, we know that the bacteria feeds off of most types of sugar. So the idea of not having any sweets is kind of like trying to starve it out, which is tough going. It could go for a long time. I mean, it's going to want to live, you know, it's a living bacteria. So starving it out, starving yourself to starve out your candida is what a lot of people do and end up depleting themselves. But Ayurveda, they could say, okay, 1 week, don't have any sweets or fruit for a week, and then drink the tea. And I have an antifungal tea, and antifungal tea, instead of just starving out the unhealthy intestinal bacteria, whether it's in the colon or small intestines or other places in the body, herbs just kill it. So it's a different approach, you know, instead of starving it, kill it. And this is same here with the herba ursi. Just fight is antimicrobial, antibacterial, and particularly useful for urinary tract infections and bladder infections. And it's been used for hundreds of years in the Western world. And gokshura and some of these formulas like chandraprabha have been used for over 1,000 years for the same condition, because these conditions are old conditions. It's not some new condition like AIDS or HIV that didn't exist in the past. I mean, those conditions, there was no record of them, so there's no ancient treatment for them. But urinary tract infections, they had it in the past. And so they had the cure also in the past. So that's the good news, that these cures are available in herbal form, and they tend to work very well. You just have to look at the diet and look at the causes. For example, if you're getting excess urination at night, but you're drinking coffee in the morning and alcohol at night, well, this is creating excess urination. So it's always important to get rid of the cause. And sometimes it's all you have to do is get rid of the cause. You don't even need to give the herb. I mean, it could be, like I said, if people aren't sleeping well, you don't give them a sleeping herb. If they're getting up tonight, urinate is the cause. So people may say, I want to sleep better, give me your sleeping herbs or sleeping tea. But I find under investigation that the reason they're not sleeping good is because they're urinating at night, possibly a urinary tract infection. So instead of giving them a sleeping herb, I flush out the urinary bladder tract pathway with this type of teas or herbs and get rid of this nighttime urination, and then they sleep better. And maybe they can still use some herbs to help them sleep a little better. I always say to people, think of these herbs as your friend. If you're getting chronic urinary tract infections, then probably you've had antibiotics, because you get the infection, then you get the antibiotic, it weakens the immune system, then it creates a cycle. So if you want to break that cycle of repeated urinary tract infections, then an herbal choice is much safer, because it doesn't create the weak immunity that a strong antibiotic does. It just does the job without creating any damage. So another advantage to these herbs is that even if you didn't have urinary tract infection and you drank a bag of that tea, you may urinate a lot, and you may even notice your flow got better. Sometimes we don't really know we have a problem until it's resolved. For example, it's a kind of a story here, and then we'll end it here. And then I'll take your questions online for those of you. But I was in India last year, and there was a man, a specialist on the street, and he said he could clean your ears out. And he had all these little tools and little oils and everything. And, I'm a pretty open-minded guy, and I believe in Ayurvedic formulas. But, the guy was on the street. But one of my students who went to my class, she said she had a big problem with it. Her ear was clogged, and it was infected, and she was she was talking about it. I guess that's how we found the guy. I forgot. Anyway, she sat down, and he cleared out her ear, and he was just pulling things out. I mean, it was unbelievable. This guy was had like a little tiny little spoon, and he was scooping out chunks out of her ear, and then he put in some oil, and she was so happy. She said it felt better instantly, and he was just pulling things out of her ear. I couldn't believe it. And then she did the other ear, so I said, okay, what the heck, I'm going to do this. And he did. He pulled out like hairball, looked like the hairball out of my ear, and the moment he pulled it out, my hearing got 20% better, 30% better. I remember my son, particularly on one side, I told him just do one side, but I ended up doing both because I knew one side wasn't working well. When I was walking with my son, for example, and speaking, I couldn't hear him on one side too well, and it went away immediately. So sometimes we don't know we really have a problem until we fix it. And that was the case for me recently. My hearing just got so much better. I didn't even realize that it was deteriorating. I took it too lightly. And that's often what happens with the urinary system, where we don't understand that it's really deteriorating until you do these herbs. And then a lot of people say their flow's better. They used to go 7 times a day to the toilet. Now they're going 3 times a day to the toilet. They didn't go at night. And now they used to urinate at night. Now they're not. And everybody comes back and pray and always talks about the great flow. Oh, great flow. Shooting right out, and then stops, no dripping, clean. That's what you want. So just like a mechanic looks at a car, we want to know, you have to know what's working to know if it's broken. If you pull your car into the driveway and in the morning you got a big puddle of water under it, there's a leaking problem. And it's the same for your urinary tract system. If you have a leaky urinary tract system, then you have this in the underwear. Oh, one other symptom which I didn't mention, which is important way to diagnose your urinary system, because it can need its own little detox and cleanse, and that's really what we're doing with these teas to some degree, is we're detoxing this whole pathway. And that's stinky urine and urine that stains the underwear. You want the urine to be just slightly yellow. It's too white, maybe you're drinking too much water. It's dark yellow, and we're assuming it's not too much vitamin B6 in particular, or multi or B12 or any B complex will create this kind of yellow in the urine. But assuming you're not doing that and you have darker urines, then you need more liquids. And of course, if you have blood in your urine, this is a serious condition, you need to have it checked. So what we want is nice flow and stopping, no dripping, and no stinky smell and staining. In fact, the human body gives us a good indicator if we are too toxic. What is that? We stink. That's right. When we go to the toilet, if our colon is too toxic because maybe we've just been going 1 time a day, which is constipation, minor constipation, then it stinks bad. If your skin and your lymph is clogged, and when you sweat, you stink. Your underarms stink. This like lymphatic congestion and toxicity building up in your fat tissue, because the body holds toxins in the fat tissue. And then when you exercise and work, you start sweating out the liquid and the toxins, and then it stinks. Same with the urinary system. If it's stinking and staining your underwear, then this is a type of toxic situation. And even in that type of condition, just like urinary tract flush, just cleaning it out once a year. Generally, you should do these cleanses for the urinary tract in the summer when it's hot and you can drink a lot of water. Just like the colon, we like to clean it in the spring after the winter. And the liver, also during the winter time, to make the digestion stronger of fat. But in the summer, it's the best time to clean out the urinary tract. And that's probably why I put this one at the end of the series, a little closer to the summer, warmer weather, and a better time to flush out and clean your urinary system out. So I hope that helped you understand your urinary system. Don't want to have to use complex terms. It's just better to understand if it's working and find the right solution and change of diet and possibly lifestyle to fix it before it advances to a more serious condition. Okay. So thank you very much, ladies and gentlemen. I'll stay online and answer questions for those who are here live. Thank you. Okay, folks. Greetings from beautiful Southern California. I sincerely hope you learned from this video and benefited from all the information. This knowledge is not my knowledge, nor is this information new, but part of the ancient healthcare system called Ayurveda, the science of life. I hope my videos explaining the Ayurvedic approach in a simple and clear manner help you to overcome your health issues. However, if you have a complex or serious health condition, I highly recommend that you contact me personally so I can meet with you here in my clinic in Ojai, California, or in an online conference call so I can properly diagnose your condition and provide you with an individualized diet and custom herbal formulas. Then I will follow up and continue to support you until you have recovered. Please subscribe to my YouTube channel below and visit my website for more information, appointment fees, upcoming events, and my schedule where you can book an appointment directly online. Thank you once again, and I wish you the best of health and happiness.